I am from the Fox River Valley area. I grew up in Freedom, Wisconsin, and I really loved my childhood here. Obviously very biased about that. My wife is also from the area, but not from that same small town. So after training in residency and then doing the fellowship in Colorado, it was an easy decision for us to come back and practice medicine here because we're near our extended family. My specialty is orthopedic surgery. However, I'm an adult reconstructive specialist, so I do hip and knee replacements primarily. I really thought at the outset of my journey into medicine that I was going to do primary care. And the reason for that is I thought that I would make the best relationships with people through primary care and being a part of their story, their walk throughout a longer period of time. But once I started to really engage in the subspecialty areas within medicine, I realized that I could have that same depth of a relationship with anybody, no matter what type of medicine I was practicing. And so it really became a matter of what was most interesting to me, what engaged me the most, and what I found would provide people with the greatest change in their lives. And that's where I really came into my own in orthopedic surgery. Early in my orthopedic training, I had experience in all the areas of orthopedic surgery. So hand surgery, spine surgery, trauma surgery, pediatrics, joint replacement, and is specifically joint replacement where I felt that I could make the biggest impact. These individuals who we were seeing had severe pain and disability, and with a single operation we could drastically change their lives. Their quality of life improved dramatically as a result of having less pain and better function in their hip or their knee. And that's why I really gravitated towards hip and knee replacement surgery. One of the basic principles or tenets of this practice is having fellowship training in subspecialty area expertise, and that is what I believe really draws people to this practice. Now, people who are my partners here have done a fellowship in their respective subspecialty areas of orthopedics and only do that particular subspecialty. But I really believe that fellowship training provides providers with the necessary skill set and knowledge base in order to handle problems with a very limited scope but a very substantial depth. That's how you become an expert. And this doesn't just apply to medicine, this applies to any industry. The more you limit what you do, the greater you become at the things that you do. It's all about narrowing what you do so that you can do what you do well. It's about having that large impact on people's quality of life. When they come to see me, they're seeing me because they have substantial pain, disability, and their quality of life is taking a major hit. They're not able to do what they want to do or need to do, and they find themselves living a life that isn't them. And so with hopefully a successful joint replacement, we can really see substantial changes that are going to restore them to a life that they once had but don't presently have.